You just
Okay. Very good. All right. So the next tip is to compare your options of your answers. So let's take a look at a few questions where that's helpful. Okay, so long stem, lots of labs to look at. So this is a case when it's that long of a stem and that many labs. This is when I'll break my rule about not looking at the answers until the end, because now I want to know, what do I need to pay attention to, right? So the question is, of the following, the most appropriate next step in treatment for this girl is administration of insulin, calcium, and sodium bicarb, potassium chloride, IV potassium chloride and normal saline bolus, IV potassium chloride and oral amiloride, IV potassium chloride, dextrose, and normal saline. All right, so it's A wants to give her insulin and D wants to give her dextrose. So, let's think about that. And E is oral potassium and propranolol. All right, so now we can read through this and try and figure out the answer. Because we're going to be focused on, what are we focused on? We're focused on potassium. Maybe we want to look at what the calcium is, and we want to see what the sugar is, right? For sure. So we can even come back here. Potassium's 2.1. She definitely needs potassium. No question about it. So we're going to pick one of the answers that give her potassium. And she's got EKG changes at the bottom there. ST segment depression, flattened T waves, and prominent U waves. So I want to give her IV potassium. I don't want to wait hours for her potassium to come back up. So just by this, I haven't even read the question yet. I already know that I'm not choosing A. There's no potassium in there. And I'm not choosing E. So I've already started reducing my choices. And now I just need to figure out, does she need a bolus? Does she need a diuretic? Or does she need sugar? So I guess we could have checked her sugar here. What's her sugar? 86. She doesn't need sugar. So now the question is, does she need fluids or does she need a diuretic? Much easier to read the question when you're thinking about those choices than when you're just reading this whole long thing. And I'm not going to read this whole long thing to you, but she's tachycardic. She's got tachymucous membranes. She needs fluids. Okay? So the answer is B. But sometimes it's really helpful to look at those answers. If you still had no clue, then I'm going to pick B, C, or D anyways, because they're giving me three choices that include IV potassium. This is for a question you have no idea what the right answer is, right? No idea and no logic that's going to help you get there. If they're giving you three choices that have IV potassium, the odds are they want you to know for sure that that's one, and they still want you to make a second differentiator. Four choices give you potassium. The answer is not going to be A. Everyone's going to recognize that this kid needs potassium. So the answer is not going to be A. So when you're completely guessing, at least pick B, C, or D. Okay, of the following, the best management strategy for this patient is: a 16-year-old boy presents to the ED with complaints of nasal pain and swelling of 48 hours duration. He sustained a facial injury with epistaxis and nasal swelling when he fell from his dirt bike 2 weeks ago. Today he has purulent nasal discharge, fatigue, and malaise, a temperature of 38.6. Physical exam reveals nasal tenderness with overlying erythema. In addition, he has a bilaterally swollen nasal septum with overlying excoriation, redness, and purulent discharge from the left nair. Of the following, the best management strategy for this patient is... All right, let's take a look at these choices. Every single one of them has nasal discharge, gram stain, and culture. So when we're reading it, we start thinking about gram stain and culture. Get that out of your mind. Every choice has that. Doesn't matter. We're not even going to be thinking about that. So really, there's two questions in here. Does he need oral antibiotics or systemic antibiotics? And do we need to do nothing to his nasal septum? Do we need to aspirate it, or do we need to do an IND? Those are the two questions they're asking you to answer. Oral versus systemic, IND versus aspiration versus leave them alone, just antibiotics. And sometimes it's hard to see that to see what the questions they're really asking you are. if you don't compare answer to answer. But they're asking us two questions, oral versus systemic, and what are we going to do surgically about his nasal septum, if anything. So let's start with that. How many people think he should get oral antibiotics? How many people think he should get systemic antibiotics? He's febrile. Yeah, he needs systemic antibiotics. Okay, great. So C and D are gone. A, C, and D are gone. Leaves us between B and E. So are we going to leave his septum alone, or are we going to do an IND? We're going to do an IND. E is the right answer. So actually, if you go in that order, you don't even have to know whether aspirating versus IND would be better. Because once you eliminate oral antibiotics, you no longer have a choice of aspiration. Right? So even if you know nothing about nasal septum infections, we can get this answer right. He's sick, he needs systemic antibiotics, and I think we should drain it. It's swollen and got pus draining from it. That's something we should do something about. Right? Okay. Sometimes working your way backwards is helpful. So, of the following, the most likely cause of this child's anemia is a patient brings her a mother brings her previously healthy 2-year-old son to the ED because he looked pale when he woke up this morning. He's had a fever and decreased activity over the past few days. He had a urinary tract infection diagnosed 3 days ago and was prescribed sulfa-trimethoprim. On physical exam, the markedly pale boy has sclerolicterus, a heart rate of 170, respiratory rate of 40, and a blood pressure of 90/50. He has no hepatosplenomegaly or lymphadenopathy. There are no findings of note on the remainder of his exam, and his hemoglobin is 5. So maybe you recognize this, and maybe you're ready to answer it. If so, great. Let's say that you don't recognize it. You don't know. You're not ready to answer it. So let's just say, all right, let's say he had aplastic anemia from parvoviral infection. What in this scenario fits that? There's a few things that don't. They don't talk to us about any kind of preceding viral infection, and he's got sclerolicterus. So aplastic anemia shouldn't have sclerolicterus. So probably not aplastic anemia. What about G6PD? Anything in here that suggests G6PD? Yeah, they gave him a sulfa drug. That's why they told us about his urinary tract infection. So I like G6PD. What about hereditary spherocytosis? No hepatosplenomegaly, and started this morning. Doesn't fit hereditary spherocytosis. Even if you know nothing about hereditary spherocytosis, it's hereditary. He's probably had it for the last 2 years. Sickle cell hemolytic crisis. The icterus might fit. But again, previously healthy 2-year-old, we should know by now. And erythroblastopenia, again, should be no sclerolicterus, shouldn't be 1-day onset. So G6PD is the right answer. And working your way backwards can be really helpful. Because maybe you're reading it quickly, you don't even notice that he's on the sulfa drug, right? You just know he's got a UTI. You're thinking this is kind of renal failure kind of thing or something like that. But then as soon as you work your way backwards, you're like, oh yeah, sulfa drugs, G6PD. I didn't remember that, but now that I am looking for it, I see the association. Okay, a 5-year-old boy is brought to, of the following, the most likely diagnosis is a 5-year-old boy is brought to the ED for wheezing and abdominal pain. While awaiting the doctor, he experiences profuse emesis and diarrhea. On physical exam, the afebrile child is in moderate respiratory distress, has a heart rate of 72, respiratory rate of 20, blood pressure of 120/82. He's somnolent. He has copious secretions, bibasal rales. His pupils are only 1 millimeter, but they are reactive. He's diffusely weak with occasional fasciculations. DTRs are difficult to elicit. Of the following, the most likely diagnosis is. So what do we know about porphyria? Is that? Right, we think about abdominal pain with porphyria. Doesn't seem like that really fits. What do we know about acute lead poisoning? Shouldn't be super acute. Even acute lead poisoning isn't super acute like this. And I've never read about lead poisoning causing, it can cause somnolence, it can cause encephalopathy, but why has he got copious secretions? Most of it doesn't fit the little bit I know about lead poisoning. Botulism might fit the weakness, but again, why does it fit? It doesn't fit a lot of other things. Guillain-Barré, You would like to see ascending paralysis. They're not going to give us a bizarre case of Guillain-Barré and expect us to recognize it. So organophosphate poisoning, yeah. So I'm really bad with mnemonics, but he's got that sludge, salivation, lacrimation, urination, diarrhea, GI upset, which is the vomiting. No, I think E is emesis. I think G is something else. Anyways, that's why I'm bad about mnemonics. What would be E before? Anyways, fits everything. So again, even if you don't recognize it at first, when you work your way backwards, you're like, no, porphyria doesn't make any sense. Lead poisoning doesn't make any sense. All right. Believe what it says. Again, a really basic piece of information. Answer the question they ask. Really basic piece of information. And believe what it says. But I see people not doing this all the time. So, of the following, the most appropriate antimicrobial agent to start is, we're evaluating a 5-year-old boy with AIDS whose recent CD4% is 18%. He presents with a 5-day history of fever, increased work of breathing, cough, short of breath, just walking to the bathroom, blah, blah, blah. Respiratory rate's 28, O2 sats 88. He's got nasal flaring, scattered crackles in both bases, moderate retraction, and a chest x-ray reveals bilateral perihilar infiltrates. And then it's going to show us the picture. Look at the picture. Fine. Look at the picture for 1 second, because you know what the picture shows. It shows bilateral perihilar infiltrates. They told us that. This is not a question about interpreting a chest x-ray. So don't look at this chest x-ray and say, oh, over there, that looks like it could be a round pneumonia. They called it bilateral perihilar infiltrates, but I think he's got a round pneumonia. He's probably got pneumococcus. No, he's got bilateral perihilar infiltrates. They tell you that. Believe them and answer the question for a boy with AIDS and bilateral perihilar infiltrates. Feel free to look at the x-ray. Some questions you'll have to look at the x-ray, right? Because they want your interpretation of the x-ray. But in a case like this, just believe them that he's got bilateral perihilar infiltrates. Same thing here. Of the following, the most likely cause of this rash is, and he's a 15-year-old boy, 24-hour history of an erythematous rash. His parents say is worsening. He's on day 4 of 10 of amoxicillin for otitis media, currently afebrile. Okay, where is the rash? His tympanic membranes are fine. His rash is generalized, non-tender, erythematous, blanching, macular rash. Then they're going to show us a picture. Don't say that looks sandpapery to me. They told you it was macular. It's flat. Believe them. It's a macular rash. Answer the question about a macular rash. Oh, I want to go back up to this for one more question. There's no blisters or lesions on his mucous membranes. Why did they tell us that? Because they don't want us to pick Steven Johnson. So that information is there for a reason. I sometimes say all the information is there for a reason, but I started this lecture by saying read the STEM and then decide about family resuscitation and ignore all the information they gave you. So most of the time the information they give you is there for a reason. Okay. Manage your time. Also really important. Track your progress. Take 30 seconds at the beginning of the test to say, I've got 2 hours, I've got 200 questions, so by 9:45 I want to have answered 70, by this time I want to... Don't do that to put pressure on yourself, but to keep yourself paced. You don't want to miss easy questions that are later in the test because you've spent 5 minutes trying to wrestle through a really hard question now. You can save questions off to the side and come back to them later. I think you can on boards too. You can flag it so you can go back to them later, and you should do that. Get all the questions you're going to get right, get them right, and then go back to the ones you're likely to miss anyways, and get them hopefully right. And answer every single question. Unlike some tests, no penalty for a wrong answer here, right? So if you don't have any other choices, make sure you pick some answers for every question. Okay. All right. Of the following, the contiguous gene deletion syndrome that best fits this child's features is. So you can read this, and maybe some of you can even answer this. I look at this question. I'm an ER doc. I look at this question. I have no idea, and there's nothing I'm going to do to figure this out. 4p minus? I don't even know what that is. So what am I going to do? I'm going to look at this, and I'm going to pick an answer, and I'm going to go to the next question. Because there's no way I'm going to figure this out. Again, if I studied more, if I'd started early, maybe I could have figured this out. But for me, today, no idea. So I'm not going to agonize over it. I'm not going to waste a ton of time on it. I'm going to guess, and I'm going to get to the next question that hopefully I can guess right. I think I looked up what the answer was so that you guys could learn something, but I'm not positive I did. And honestly, I had no idea. So new to your area, 3-year-old, delayed speech, recurrent otitis media with tympanostomy tubes, tetralogy of Fallot, microcephaly, underfolded pinna, broad nasal bridge, cleft uvula, small chin. Hypernasal quality of her. Hopefully I put the answer in, because if I didn't, no, I didn't. All right. So, sorry, I have no idea. Do we have any votes? 22Q11, I hear a couple of votes for that. Okay. So, there you go. Apparently some of you have studied more than I have. Okay, so what are the keys to success? Read the question first. Read it carefully and answer the question you're asked. Then you read the stem. Try to predict the correct answer. Read that stem for extra details. Again, migrant workers' children have insecticide poisoning. Compare your options. Work your way backwards. Believe what it says. And manage your time. And study. Is that the one that's the part you're worried about? All right. So you got all the rest of it? It's just the studying? All right. So I think that's it. I felt like I had to put a little sign up for my new place. So any questions or comments? All right. Hopefully it was helpful. I better leave before Dr. Giordano sees the carpet. Thank you. I appreciate it.
It's recorded.